What's up, people? How you doing? Happy New Week, guys. Guys, just a quick chit chat. I put out a post and I said, why do people don't like going to the hospital? And I go loads of comments. Somebody said, fear of the unknown. Someone said if she feels irritated while in the hospital, she prefers to be treated at home. She feels nauseous around the hospital. Some said it's because of the bills, hospital bills. That's what most people say. Some says, I'm scared of taking drugs, injection. I'm scared of the test, to hear the test results. Hospital bill, fear of the unknown. I'm just afraid. Fear of the unknown. Hospital bills, money to pay hospital bills. Hospital bills. Somebody wrote an epistle. Said lack of money to pay hospital bills, poor management from nurses and doctors, not able to stay away from kids, especially women. Not able to stay away from kids, especially women. I don't know what that means. Poor hygiene of some hospital distance, high cost of transportation, just scared, I'm afraid of injection, needles, blah, blah, blah. And the list goes on and on and on. To be honest, guys, everybody has gotten a point. I don't like going to the hospital as well. Hospital is not an hotel. It's not a party. So no one wants to go there. But with all these excuses, let's be factual now. Let's call it spade a spade. Is there enough reason why we won't go to the hospital? Oh my goodness. I know the bills are so something else. But regardless, I don't think we should wait till when something is wrong in the body, in our health, before we know we have to go to the hospital. Some say they are afraid. Afraid of what? Of bad news or something. They don't give bad news all the time in the hospital. And at times, some bad news can be corrected. That if you go to the hospital and say, oh, so sorry, we just checked your blood result, we just checked this thing and we realize you have low blood count, you have low potassium, your cholesterol is whatever. They can be corrected so that you hear bad news now and the bad news can be corrected. It's better than when they say, so sorry, there's nothing that can be done. Even when they say, so sorry, there's nothing that can be done, but you can still manage it and live a good life. It's not better than when you didn't go, you are neglecting, you are afraid, you are scared, you're neglecting some things because of hospital bills, blah, 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 and something bad happens. God forbid. Everybody says God forbid, God forbid. Yes. Heaven helps those who help themselves. Some are saying because of hospital bills. But some things we spend our money on is more than the money we spend on hospital bills in some cases. And there are some bills we will pay for hospital bills, right? That it's going to be like a one-off thing and we don't need to repay that money if we tackle that thing on time. Somebody said the environment is dirty. Well, you have a point. Some said the hospital is always smelling of medicine. I know that happens a lot. Maybe this general hospital or all those health centers. I don't know why the environment smells. Then that means the hygiene level of that hospital or of that clinic is on point. When I got to this, I assume and I believe that I thought hospital smells of injection of medicine, whatever. It has a kind of like awkward kind of like smell. But when I relocated abroad and I started using the hospital, not even as a worker now, like for medical reasons, when I was pregnant and I need to go back to back for checkup and antenatal, whatever, I can't perceive any odor. I'm like, wow, I think is the hygiene level of the hospital and which hospitals needs to like take note of and work on that. The hospital where I work, I used to say that they spend more on cleaning staff. Like they spend more on the cleaning department than any other staff, other department, because there are cleaners. Like there are cleaners and there are cleaners and there are cleaners. There are cleaners for each ward that will clean everywhere, every day, every minute. When one closes, another person is resuming to empty the bins, to tidy this, to use a lot of chemicals to sanitize everywhere. You know, they're using the machine to scrub, to mop, to clean. And then so why will the hospital smell? So even if it smells, and now imagine or assume that it smells, but you're gonna see the doctor, a consultant that will now attend to you well and treat you well so that you won't come back again. It's not better. It's not your house in the first place. It's just that when you go visit a place, visit somebody, it is not your house. Whatever thing you perceive there, you have to swallow it and adjust and adapt till you live there. And pray never to come there because you don't like the atmosphere. But if there is need for you to come back there the next day, my dear, won't you go? You will go there. So it's not better you perceive the odor. Take your medication. Pay your bills. Forget anything that will bring fear. Why are you scared? Yes, normally when you go to the hospital, there are different conditions. There are different people with different this and that. That scares everybody because you're like, but you praise God, don't let my own get that. But at times, some neglected their own self and led to that. So if you notice your own on time, you don't even need to notice or perceive something is wrong with your body before you visit the hospital. Say, let me go for normal checkup. Get some medical kits at home. Get your thermometer to check your temperature, your children's temperature. Get the monitor, the blood pressure machine to be checking. When you notice something that's up, go to the hospital. Say, okay, I think I checked my blood pressure yesterday and something is not right there. Things like that. And let them take it up and say, okay, it's fine. Rest, take a break, blah, blah, blah. At least, even if just all those male LD tips, advice to live well, what's it to go to the hospital? So guys, I think everybody should change their mindset saying because of hospital bills. Because there's some money we spend on some things that are not really necessary. They might be necessary, but when it's time to go to the hospital, we can also still divert and say, okay, for now, let this thing hold while I concentrate on my health. And we're going to live a better life. And this issue of saying, I cannot take I'm scared of needles. I'm scared of medication. There are some things we do that hurt us more that cause us more pain than the needle. It's just one sharp scratch. And that's it. Right? You go and make your hair, you sit down for 5 hours, feeling the pain every now and then. Is that not pain? You've gone through childbearing, is that not pain? You've had a fall, you had whatever, you are going through pain, you bent your finger, your hand while cooking this and that. You get into a fight with somebody, you hurt yourself. Is that not pain? So why not take that pain of sharp scratch? And a couple of days you are fine, or within 30 minutes you are fine. Like if you go for your blood test and the phlebotomist have a scrap, what's it called? Sharp scratch and the taking whatever you're going, and you are fine. And let them detect what they want to detect and to treat you. I think most of us need to change our mentality about, I'm not going to hospital because of the bills. I'm scared. You are scared and something is wrong in your body. So when will you not be scared? Guys, that's what I have to say about this topic. Please, let's go to the hospital when we need to. I'm not saying you should be going to the hospital every day. I'm not saying it because I'm a hospital staff or I'm a healthcare worker. No, I'm saying it because anything that is worth doing or what's necessary or what is important, we need to do it. We need to do it. If you are scared of going to the hospital, but when your children are sick, you are ready to take them there. But when it's your own, you don't want to go. A word is not for the wise, guys. Thank you so much for joining. I will see you in my next video. Take care.